Hello everyone, my name is Christina Hughes, and for my final Education 5200 project, I've chosen to focus on maternal health justice and how access to doula training can make an impact. This is an area of our healthcare system that I'm very passionate about and look forward to sharing with you. Today, equal access to maternal health rights across populations is abysmal. Women's decision-making, authority, and autonomy have been stripped from them by the medical system and through prominent domination present in the birth environment. Because this injustice is such a huge topic and there's no way I could tackle such a critical issue, I chose to drill down into and explore areas that give autonomy and authority back to mothers. One way this can be accomplished is using doula services during birth. What is a doula? A doula is a trained professional who supports women and their support people during birth and labor. They can be advocates for the woman's desires as well as encourage and empower the woman to remember her birth plan and decision-making abilities during the birth process. While there are numerous issues, what I'll focus on today is cost. Doula training can often be expensive and out of reach of those who want to become doulas, and the cost of hiring a doula can be out of the reach for many families. Both issues result in less women with access to doulas, a service which could vastly affect their birth experience. So what social action is needed to affect change? The positive effects of having a doula during birth need to be made clear so that the field either receives funding and/or individual doulas or practices can set up and address how their services are offered at a lower cost. Connecting this issue to course materials, I'll talk about the feminist model of justice from Clement, a bit of feminist theory, and John Rawls' ideas around a just contract. Merriam and Bierma, in their 2014 text, Adult Learning, Linking Theory and Practice, defined feminism, while lacking a unanimous definition, as focusing on women and other marginalized social groups to bring attention to inequality in areas like politics, economics, health, and society. It shows us how the same path can be more difficult just because we're women. Feminist roots are seen in Clement's notions of the ethic of care and justice. I specifically relate her human connectedness in the ethic of care and the equality as priority from the ethic of justice descriptions as key features that could promote justice in the doula training and affordability area. By remembering that connectedness of women and that equal access is a priority, we have a platform to start change. The 2006 Deutsch article talks about oppression and its connection to systemic justice, which I think is also appropriate when we talk about birthright. He mentions that one cannot overcome injustices without first heightening their awareness and sensitivity to them. Doulas help bring awareness to injustices in the birthing room by encouraging the autonomy of the woman who is traditionally oppressed during the birth experience, even more so if she's a minority. Lastly, John Rawls in Social Justice Theories, Issues, and Movements talks about how a just social contract would not privilege or oppress any person based on their social class, gender, and beyond. Women are oppressed in their birth experiences as well in their rights to afford advocates to change that birth experience. I'd like to switch gears and now talk about why this issue is so important to me and what I did for this project. I grew up with a neighborhood family that was very poor, yet had a lot of children. I was always curious about what kind of support or lack thereof they received. As I got older, I started reading about the differences in medical care between populations, as well as the differences between government-funded healthcare and private insurance companies, and the stories shocked me. This perspective and how politics and political agendas are affecting and threatening women's rights contributes to why I also care so much. I'm worried that when it's my time to experience birth, even with my white privilege, I won't have the birth experience I want or deserve. I feel strongly that doulas can help change this story and that cost is the biggest issue facing creating a lack of abundance of doulas and our access to them. To attempt to first understand if this opinion was shared in the doula community and how it might be addressed, I conducted an interview with Carrie Kenner. She's a prominent doula and owner of Big Belly Services in the Seattle area. Through my conversation with her, it became apparent that access and cost are huge issues in the doula community. She works hard to fight this by offering sliding scale fees, scholarships, pay what you can doula services, and more. Second, I wrote a letter to Doula International, which is the National Doula Association that certifies doulas, addressing the issues outlined in this presentation, as well as asking them if there were any measures in place to reduce training costs, provide scholarships for doulas, or families in need of doula. From conducting this interview and writing this letter, I feel like a passion has been sparked in me to continue learning about this area, to explore more feminist perspectives, and to see how, when I move into the childbirth space, I can incorporate some of the theories of justice and ethics into my business practice. Additionally, Carrie agreed to invite me to her next doula training to share my thoughts and research on these topics with her future doulas. I have not yet received anything back from the Donor Association letter, so I don't know what the outcomes of that letter are yet. This process has definitely reinforced that I have a part to play and that no act is too small. Carrie proves this through her discounted classes, retreats, and sliding scale for her customers. She's continually affecting change by training the next generation of doulas in an affordable manner, providing more doulas who also believe in reducing costs for their clients. For further exploration, I believe more doulas can be involved in the conversation, especially if taken up by professional organizations that oversee doula training. Change might actually occur. Further questions for me include, how can I have an influence without formally being a part of this community? And how do I start action or be involved in changing bigger issues of domination and oppression in the childbirth landscape? Thank you so much for listening to my presentation. If you have any questions or would like to discuss any of these topics further, I'm happy to enter into a conversation. Thanks so much.